ankle for this ankle and foot workshop. So let's start with this. We need to keep it, like, it won't be full, it'll be around 5 minutes.
Yeah.
Full disclosure, we spent plenty of time conversing up front. So this is going to be abbreviated for the purpose of just seeing the process, if you will. We hope to see some 5-minute miracle where she's high-fiving me. We may or may not get to that. That's not important. What's important is you kind of see what's the style and flavor of the type of interventions. Fair enough?
Yeah.
Okay. So, couple
This is my
sentences.
compression
Sentences.
socks.
What's going on with you?
This is my compression socks. Right now, I'm just, sometimes when I walk, I feel like I may have my shoe on. You know what I mean? But I don't. It's kind of something, I don't know, whatever that is all about. But I like to say, I can get ready for bed and do everything and put my pajamas on and go to bed. I never have any pain or anything while I'm sleeping, in my bed. So let's see what else.
So tell me what your main complaint is. What's your main thing going on right now?
The burning.
Burning. Show me where.
Right here.
In the front of the foot.
Yeah.
Okay. And what really brings that on? When you're on your feet?
Yeah, I'm on my feet, but
Not all the time.
not all the time.
Okay. And that's been with you how long?
Oh, 3-4 years already.
Getting worse, staying same, or getting
No,
better?
it's about the same actually.
Okay.
It hasn't really gotten worse, but it's about the same.
Are you okay taking those off?
Yes.
Okay. And you also,
I didn't shave my legs, so don't.
I didn't either. Don't worry about it. Yeah.
Me
I
either.
said, hey.
So do I want to talk to it?
If you would, please.
Okay.
We'll just tell everybody it's the middle of
Yeah.
That's okay.
Hey, well, that male
It's
of
middle of
winter,
winter
that would be
Wisconsin.
worse. Okay.
So, point to where you feel that, where the pain is, right on the bottom of the foot. Okay, so in my mind, just for those of you, I'm just starting the process. What do you think? Okay, what can that be? I've got some leading contenders, but we're going to start to work through this.
And I don't know why this has happened, but I think about the last couple of years, I said, why am I getting black and I didn't drop anything on my foot. Why am I getting black and blue? And now I'm touching it and pretty hard, and it hurts a little, but it isn't like a pain, My pain threshold's pretty good.
Yeah.
It has to be to have these feet.
Clear. Fair enough. So clearly, there's some discoloration there. I'm gonna be taking that into account. There's some added stress to that limb.
But see,
Not
and this
sure
is the one that's got the blood clot in it.
why. You have DVT in there.
Yeah.
How long ago was that diagnosed?
About
Approximately.
about 4 years ago, because I was having such pain in the back of my
So,
here. So I went to the doctor and
so you have a blood clot diagnosed, and now for the rest of your life you're going to be on blood thinners. And you have
Right.
to monitor your blood
Right.
levels so that doesn't reoccur. So
Yeah.
for those of you who are
Yeah.
watching or aren't familiar. So,
yeah,
Okay.
but
fair
it
enough.
was I could hardly get in and out of the car. That's how bad it was.
Right.
So I thought I better get to the doc and find out what it was. So they took an MRI and they go, you have an old blood clot in your leg.
We love modern medicine for managing things like blood clots. I'm on tape.
Yep. She said, did you have an old blood clot? She said, have you ever had a bad fall? I said, an old farm girl has had a lot of bad falls.
So you're retired now.
Yep.
What type of work did you do?
No, I still work. I couldn't stand retirement.
What type of work do you do now?
I am a morning stalker at Menards. You're in Oshkosh.
Your morning
Stalker.
stalker. Okay, nice. All right.
I like it.
So what I'd like to do, if you would please, I'm going to have you come to standing, and this time I'm going to hold the chair still. I'm going to have you sit on the chair once more. And once you cross your arms, just want to see how you come to standing without using your arms. Okay, thank you. You can let your hands down.
Okay.
You can stay standing if you would please.
Oh.
Good. So first thing I'm
See,
going to
now
do
it's
is
hurting me right now.
bothering you right now.
Right there.
I move the chair. Please don't sit down.
No, okay.
Okay. So what I'm going to have you do is I'm going to have you just take a short walk to the end of that room there. We're just going to kind of take a notice what your walk is like. And walk here and pass towards me. it doesn't take a trained doctor of physical therapy to identify that she's being very tenuous with that side. She's got a very stiff type walk, and she's got a very short and step length.
That's what
Particularly
they told me when I
she
first
right
came
leg.
here. They go, God, you're really stiff when you walk. I thought,
So,
really?
any human can identify that.
Okay,
Okay, so I'm gonna start asking some questions about
okay,
What I'd like you to do is come forward a little bit, right here. So you're raised on a farm and you worked on the farm, right? Like,
right.
yeah, you just weren't in the kitchen cooking, you were out
No.
doing stuff. Feet shoulder width apart if you would, just naturally.
Do what?
Put your feet shoulder width apart.
What does that mean?
Move your feet apart a couple more inches. There we go, thank you.
Okay,
What I'd like you to do is keep your heels on the floor, but I want you to go down into a squat to the extent that you can comfortably with control. So lots of bending forward to accomplish that, right? Not as much bending the legs. She bends the legs somewhat, and then she starts to lower her chest to the floor, so there's not as much bend in the ankles.
right, okay.
We ordinarily might assess steps and that sort of thing, but obviously steps are going to be challenged for you. I suspect you don't go down much with the left foot first.
No.
Okay. So her
But
ankle,
I've worked on this.
her ankle and foot doesn't bend enough.
I mean,
You can see
I'm
that.
at Anytime Fitness for 7 years.
Yep.
And we do wall sits.
Yep.
We do all those things, and I've really progressed in the last 3 years of doing those things.
I'm a huge fan of that. You're way better off for that. 3.5 years she's been exercising. Her ankle and feet are
Oh, no.
not up to par.
Well,
Have a seat.
yeah. I've been a member of Anytime Fitness for 7.5 years.
Okay.
And I go almost every day.
Oh, nice. 7.5 years. Nice. Slide back a little bit. There we go. Come forward just a bit. All right. Pull your big toes back. Hold them back. Don't let me move you. Don't let me move you. I'm going to assess the strength of her legs here. Hold your foot up here. Don't let me move it. Don't let me move it. I believe she's a farm girl. Hold. Little noise in the joint there. Wouldn't be a shock if she had a little bit of arthritis in her knees.
But I just put that on my mind.
I'm going to specifically check the actually I'll have you lie down for that portion of it. I'll give you that. Yeah, you good. I want to measure ankle mobility. This is a right angle, like a book angle. Okay. Now, mathematicians would say that's 90 degrees. We'll call it 0. What I'm going to be looking at is I want you to pull your toes up as far as you can. This is her comfortable side, quote unquote good side, and I'm going to measure that. That measures right now, I'm going to call about 12 degrees. 12 degrees. Pull back here. She's working like the Dickens, but she's only getting, she's not even getting to a right angle. She's 2 degrees from a right angle. In other words, this
I
is
got
the ankle.
problems.
When her heel touches the ground, her foot gets to the ground. This is right now a 90-degree angle. Ideally, for an active person, you'd have up to 15 degrees beyond a right angle. She's at least 17 degrees off. So she's got profound stiffness in that ankle every step she takes. Muscles are solid and strong. I'm going to bend her knee up and remeasure that. Why am I going to do that? I'm going to do that because I want to see what her calf muscle flexibility is like and see if it's the calf muscle or if it's the ankle joint. The range of motion is a little bit better, but not where we need to be. At 9 degrees, so she's still off a bit. Her calf muscle is tight. I suspect, given her history of DVT, deep vein thrombosis, blood clot, that the tissues and connective tissue here had tightened up, and she never got it lengthened afterwards. It was painful and swollen. That inflammation stiffened tissues up, and she never got either both the ankle joint worked out and that muscle. So her calf muscle, the gastrocnemius muscle, this muscle here, doesn't lengthen as much as it should, nor does that ankle bend as much as it should. Her big toe, is that seem clear? Big toe, straighten this out. Big toe, yeah, I'm happy with that. Allow me to move you, you relax. That's close to 90 degrees, I'm happy about that. I'm gonna assess her hip joint quick. She's been working out, doing stuff at Planet Fitness. She's pretty flexible there, maybe not perfect, but pretty darn good. So,
Oh, gave me a pain in my.
cramp there? Yeah. You can bend this one up.
That is crazy.
Isn't that nuts? All right. So what I'm gonna do is I'm actually gonna do some joint mobilization techniques to help loosen up that ankle and foot joint. I'm gonna do that, the intention is to create more mobility in this part of the ankle and foot joint. I'm gonna do some techniques to get more length, to work that connective tissue. So I'm just gonna straddle the table here.
Okay,
It's the easiest way to do this. I get my flexibility program. Let that foot behave.
okay,
All right. So what I'm doing is I'm just simply stabilizing her just below that joint. I'm gonna do some gentle stretching to this area. I don't know if you can see that really well.
Can you guys see that?
Tell you what, let's say you spin around.
oh, yeah, okay. This, me over here, yeah,
That's
okay.
perfect. Then you can bend this knee up to keep your back comfortable. And I'll be bend this up. There we go. That's better. So, stabilizing here.
Oh my God. I'm not kidding you, it's just unbelievable. There we go, there we go.
That should behave a little better.
Yeah,
All right. So, to you folks, it'll look like I'm not doing much at all. What do you feel as I do here, as I do this?
yeah.
What are you feeling?
You got your hand around my ankle and
Uh-huh.
you're pulling up on it.
Uh-huh.
Doesn't hurt, but I can feel that it's stretching out.
This is a technique we call joint mobilization. So the joint tissue has a joint capsule. That joint capsule is what holds in the joint fluid for any given joint. All the joints in the body have joint fluid in them, and they have a bag that holds that fluid in. That's connective tissue. That connective tissue, in presence of inflammation, irritation, or inactivity, will stiffen up. And when that stiffens up, what happens is it doesn't allow normal motion to occur at that joint. So I'm literally doing this sort of thing. I'm exaggerating on this mild, but that's what we're doing. Internal joint massage. Ultimately, at the end of the day, her ankle and foot needs to move more for her to, she's already doing the steps in the day. She's a stalker, she's going to work out. She may even
When I worked at Quick Trip, and I worked there 12 years, I walked 14,000 steps a day.
At Quick Trip. Now the other thing is I'm going to assess that ankle, that heel bone. Notice here, there's a little bit of movement here.
Mm-hmm.
Is there any movement here? Nothing.
Nothing.
So what I'm assessing there is this action of this, which no one ever thinks about, right?
Mm-mm.
I was never trained in this in physical therapy training, right? But that is vital movement to occur because that's part of the natural walking cycle. We'll work on this a little bit too as long as we're here. This might take this out to a 13-minute miracle, but we'll continue to do more.
Are you stretching that muscle in the thigh, in the calf?
Nope.
Okay, just working just on the ankle.
Yep,
Okay.
I'm doing this.
Okay.
Right. This is better than
Yeah.
this is better than the pec deck at Planet Fitness.
Yeah.
Or you go to Anytime.
Anytime
Fitness.
Fitness, yeah.
Little classier joint.
Oh, yeah. We've got
Oops, I said that on
trainers
tape, didn't
and
I?
we used to have one, his name was Tommy.
Uh-huh.
And I was having trouble with my leg. So he says, well,
Pull your, uh-huh.
we went and got my thing that you could, put on your foot, and then I'd raise my foot up, and I'd pull back. I did that, for a good 3 months. Plus they have things at Anytime Fitness that you sit down and you bring your legs up. Boy, that I've been doing that for quite some time.
I'm a huge fan of strength training, Dave, you know. Pull your toes up, way up, way up, way up. Now, I don't know if you can see whether or not that's got more motion there. It's got more motion there. She's registering 8 degrees of motion now. She's up 10 right now in the short term. So right as of now, she's got about 3/4 of the movement that she needs in that ankle and foot. That ankle joint is still stiff. That heel bone is still stiff. She's gonna get up, we'll watch her walk, she'll report what she's feeling, and we'll talk further. Bend your knee up, but I'm really happy with the outcome. Bend this knee up. Take your time, come up to sitting on the table, swing your feet around. Shift back a little bit. There we go. All right. When you're ready, come on down to standing.
Okay.
So we're doing this in stages. I want you just to sense, to feel. What does it feel like standing on that now?
Yes. All right.
Different than before?
Yeah.
Take a walk across the room, please. What do you
Feel
feel?
very good.
What do you notice?
I think I'm lifting my feet more.
They're both moving now, almost the same, where before.
Yep, the toes are bending.
Yep, it was just like, kinda like shuffling.
You know, and I never ever, because when I was here and I talked to Robin, she goes, you're not walking. Does that hurt when you walk? And it never did hurt. It didn't say it was not. It wasn't hurting. But
Have a
that
seat.
that I couldn't believe,
That's hard to believe.
isn't it?
Every day, all the time, right? It's very simple. The joints have to move. If the joint can't move, the muscles can't function properly. If the muscles can't function properly, they get weak. If the muscles are weak, you can't do the things for extended periods of time that you want to be able to do. She may have other things going on, right? Like we're gonna have to, like, the question is, well, how long will it last? What do I need to do, right? So her body wants to pull back into some of those old patterns. If she does nothing else but this today, and doesn't change anything else she does, this is not gonna be long lasting. Now, if she takes my advice and stretches her calf muscle, not like a mad woman, but just comfortably, 30 seconds, 2-3 times a day, for 2 weeks, she'll probably maintain that, but she's gonna need more work. That calf muscle needs some work. There's that swelling that's throughout there that's not normal. We've got to kind of get some of that circulation going with other
Because my leg is swelled, right?
The right one's more swollen than the
Yep.
left
Yeah,
leg,
but
that's
this
also
is
the one you had the operation.
That's
on.
what-
Absolutely.
Okay.
But tissues change over time.
Mhm.
That can change, right?
Mhm.
And we can work that. So here's the thing, is that there's phases of progression, right? And first phase is to relieve. We've got a little diagram for this, so I'll go off the wall and show you, right? First thing is we got to relieve pain and inflammation. Right? We got a bigger diagram of this, but first stage as we get to recovery is to relieve pain and inflammation. We want to get to this stage. Next stage, we want to correct the imbalances that cause that. Joint stiffness, muscle imbalance. There might be some nerve-related issues there, maybe a host of things going on. Then we want to strengthen that muscle in its newfound range. Right? That's the next phase. Get it moving. We can do some nicey-nice stuff. The nicey-nice stuff gets it moving. Towards, as we get further into planet care, we're not just doing nicey-nice stuff. You're starting to work a little bit so that the tissue can manage some of the loads that occur in daily life. Then we want to make sure that she can preserve her abilities so that she can do a wide range of things. She still wants to stock shelves, she still wants to get doing her workouts, and she can be doing those better. And maybe there's other things that she wants to do that she hasn't told us yet. Maybe she wants to go to kite festivals and go to fairs and
I want to play pickleball.
play pickleball. That is not a solid leg to play pickleball with. Someone's going to hit it towards her right side, she's going to be like, nope, not going after that one, right? To her left side, all day.
That's
Right?
really, that's what I
Yeah.
do. I want to play
Right.
pickleball.
Perfect, right? So awesome, she wants to do that, right? So but whatever that is for her, so at the end of the plan of care, she's left with a program. She knows exactly what few stretches to do, exactly what strengthening she can do for her. That's not gonna be a problem because she's already involved in the strength training routine. She's been exercising already. I'm a huge exercise fan. This is a classic case. Exercise ain't enough. Doing the hands-on work ain't enough. You combine the two, now you're talking, right? She may also benefit from some dry needling to calm things down in terms of
That's what
nerve-related
Robin
issues.
said, we might have to do that. She said, you're not scared of needles, are you? I said, why would I be scared of something that's gonna help me?
Well,
You know, that's the way I look at it.
so that's why I love coming to work every day, because we can really help out with outcomes, like get people to achieve more than they could from any other kind of program, if you will. Hands-on work is good, exercise is good, combine them, you get much better result. Then you start teaching people what to do to self-manage. Maybe we talk about some footwear. We didn't get into the discussion. This is why I don't think it's important to start with a discussion of which orthotic do we recommend or should I have an orthotic, because if that ankle and foot doesn't move properly, it doesn't matter what kind of orthotic she has, it's not gonna help, right? Now she might have an orthotic that's more or less comfortable, but now when your ankle and foot is better, and we fully assess what muscle control and balance, we haven't even got into that yet, then okay, if she's got better balance and muscle strength around her hip, when she steps on that foot for that few microseconds or seconds, then she's got a much better muscle control, and then maybe she doesn't need such a stiff orthotic, or maybe she doesn't need one at all. I don't use orthotics. I used orthotics when I was 11 years old.
See,
Right?
whatever.
My feet were horrible. I literally had the orthopedist who evaluated me that wanted to fuse my feet, was a good friend of my family's. He took pictures of my ankle and feet when I was a young boy and wanted to fuse them. My mother completed high school, my stepfather never did. They had enough horse sense that that didn't sound right to them, right?
Mhm.
I went a different route. I saw him about 12 years after that. He said, he actually did an operation on my stepdad. He said, did you have a kid that had problems with your feet? Yeah, this is Eric right here. He said, take off your feet. I'm like, all right. He did an examination. He says, this isn't the same one. I said, I'm the same dude. Like, we've been in church every Sunday. For the same church the last 15 years, right? Like, he just couldn't fathom that someone can change outside of a surgical intervention. It just wasn't in his realm of possibility, right? So, but when you change some of these things, you change the way that it functions over time. And regardless of the age. Obviously, she comes to me at age 25, she's gonna change at a faster pace than she is at age 65, right? But the change is still possible.
And it all stemmed about, I felt like I don't want to fall. You know what I mean?
Right.
And that's the
I mean,
reason
talk
I'm
about
here.
grit. Like, I did not expect to see her, when she told me that she works out on a regular basis, to struggle so much with basic walking, right? So, but anyway, your movement capability will change dramatically.
Mhm.
Awesome. Couldn't ask for a better demo. I'm glad you got some relief. Where do we go from here? So you all have looked through your paperwork there. Obviously, you see the Google reviews of folks that we've helped here. You've had a chance to see this. Next step is, hey, look, you've been here. Why not come in for a complimentary discovery visit? We'll go through a very similar process to this, maybe a little more in depth. You might fill a little more paperwork. Those are just complimentary for you attending here. We can do any, most people want to see what their insurance will contribute to our plan of care, so we can do the insurance verification ahead of time.
As light as a cover.
And either way, oftentimes people have deductibles or copays. We'll let you know exactly what it looks like in terms of the number of sessions and what your commitment is to a plan of care, or how many sessions it will likely take for you to get to the result that you're looking for. And that's it.